it's a sobering fact, isn't it, when we think about the statistics. You know, 1 in 5, perhaps even 1 in 4 women are affected by.
Welcome to Patient in the Room. Today we're talking about maternal mental health, and I'm joined by 2 incredible doctors, Dr. Ruby and Dr. Alice. Welcome, guys.
Thank you. Thanks for having us.
Do you want to tell me a little bit about yourselves, your career today, and why you've kind of chosen your career paths?
Absolutely, Ruby, you go first. Shall I start? Well, thanks for having us, first of all, and really starting this conversation about maternal mental health. So I've always had an interest in women's health and reproductive health. My journey started over 20 years ago now, and I actually started in obstetrics and gynecology as a trainee, and that shifted into sexual health, and then I finally ended up in general practice with a special interest in women's health. And I think my own journeys with my 4 own pregnancies and my 4 beautiful children has really solidified my my interest in women's health as well. So, Alice.
So my name's Alice, and I work as a GP, and I've been a GP for quite some time now. About 16 years, and I've always had a specialist interest in gynecology as well. So I work as a GP in Newham, and then I also work for a gynecology collaborative over in Tottenham, and then I work 1 day a week as well for the Spital Clinic with Ruby. And I have 3 kids as well, so I have some personal experience of obstetrics and gynecology. I've got my eldest is 11, my youngest is 5, and I very much enjoy women's health, and I'm a big promoter of all stages of women's health, to be honest. So it's a pleasure to be here. Thank you for having us.
I wanted to kind of open up with a word that I've seen a little bit more on the internet. I've kind of been researching a little bit, but that word is matrescence or matrescence, or however, like, I feel like there's so many different ways of saying this word.
Yeah.
But this word doesn't actually exist in the dictionary.
No.
If you type it into a Word document, you get like the little red squiggle. From my understanding, what I've kind of researched it means is it's almost the transition into motherhood. So it kind of describes everything around that. So like the chemical changes in the brain, the physical changes.
Yeah.
Why doesn't this word exist in any dictionary? Like, why should it?
I think it's a really good question. I have to confess it's only relatively recently been in my vocabulary. I've only fairly recently found out about it and listened to a couple of podcasts about it. There's obviously Lucy Jones, who wrote her really amazing book. So it's, I think it's a word that we hope will get into the dictionary, but I think it's a great word really for recognising this transition of women becoming mothers, similar to adolescence, and it really does need some terminology, because I think it really helps women understand what they are going through at a time that can be really tricky. There's so many different changes when you become a mum, and I think it definitely needs a word. And as a doctor, having this word, and I started using it with my patients, and it is something that really resonates with patients. It's a great conversation to have about this process. So it needs a word. I think.
Absolutely. And I think, I agree with Alice. It's a transition. It's an evolution. It's almost, we talk about the birth of a child, but it's a birth of a new mum as well.
Yep.
And I think it validates that for a lot of new mums as well. We have a word for adolescence. Why don't we have a word for a new mum becoming a mother as well? And I think often it can be almost like a light bulb moment for many women. Interestingly, I think it was a term that was coined in the 1970s by an anthropologist, Dana Raphael, but it's recircling back now. And I think that's really important as well, because we need to be having these conversations with women that perhaps when they talk to us and say, I don't feel like myself, I don't know what's happening. And whilst we as, medical professionals, we want to explore that a little bit further and find out if there is anything else that may be going on behind that, I think this term really helps to provide some sustenance to what the woman is going through as well. So yes, I think it is a great term, and I will definitely be using it a lot more in the future. And perhaps if it's something that I recognize with my own pregnancies, I think it would have maybe helped me navigate some of the challenges that I had with my own pregnancies a little bit easier as well.
Yeah, the World Health Organization actually quite recently identified, growing health crisis of maternal isolation, and I feel like having a term for how you feel, what you're going through, can maybe unite people and open up some of those slightly more difficult conversations.
There's absolutely. Yeah, I was going to say, I think really you touch on that when you talk about, who talking about a lot of maternal isolation. Previously, our ancestors, there was a tribe. We had a village. Raising a child, it takes a village. And I think in today's society, new mums, we can often be isolated. Perhaps if we think about culturally, in different cultures, there is often, in terms of you will have that extended family or extended network to help support mothers. There is, in a lot of cultures, there's a period of 40 days where a mother is looked after. We don't have that in our society. There's additional pressure for women really to take on the burden of, looking after themselves. But in essence, also, they have there's a societal pressure, but also the isolated pressure at times as well. And that can be overwhelming as well. And perhaps we talk about, often we talk about normalizing that there's a new, everything should be this perfect picture. But actually, there are times when it isn't the perfect picture always.
And I think in some ways, modern life, we've perhaps brought it on ourselves in terms of, we are very independent as women. We are going out to work. We are, acing it in lots of different fields. But then, to be sat alone for a long periods of time in a day with a small baby who is 100% dependent on you, and to not, we in this world of sort of social media and these perfect pictures, and as well as that, I think modern society puts a lot of pressure on coping, and so you have a lot of different inputs, I think, from different places to say this is how it should be done, and actually it causes its own perfect storm in many respects. And that's certainly something I see a lot is the isolation that mums feel and not being able to talk about these less than perfect times, And I think there are obviously there are some brilliant things going on, some wonderful groups, and it's an opportunity, isn't it, to meet people and to have a time where you can meet some different people, and you are often bonded by your children. But at the same time, it can also go to some other extremes, and that's when we see mental health really spiraling for some people.
Yeah, and I feel like there's always that pressure of, I don't want to be the only mum in the group that maybe isn't bonding as well as I thought with my child, or my child's struggling to feed. That feels like my fault. And I feel like these conversations are so important, because that is just, it's so normal to feel like that, I don't have children of my own, but, I've watched my friends quite recently become mothers, and it's been such an interesting experience kind of watching how they've evolved. It's quite, it's incredible.
Yeah, and I don't know whether you find this as well, Alice, that perhaps that sometimes when when new mums might want to voice those concerns, that often they might get dismissed as well. Actually, this is quite normal. At least you've got a healthy baby. But at the same time, a healthy mum is really important as well. So we do need to talk about having these normal conversations and, I guess, reduce the stigma attached to it with maternal health. I do find this a lot of the time with the patients, and not every time will a mother come to you with what she's experiencing, and it's actually just checking in, whether you're a friend, whether you're a family member. How are you doing? Is there anything I can do to help support you? And at the same time, if every point of contact, and it might be a new mum bringing her baby, quite a numerous times. It might not necessarily be for herself, but if there's multiple instances, heightened anxiety, then I think we need to sit down and reflect and actually let's look at this new mum and see what's going on for her as well.
Yeah, I feel like there can be so much focus on how's the baby doing? Is the baby eating, sleeping, pooping? And there's often very little focus on the mother who has just been through something absolutely nuts. It's insane.
She's grown a tiny human being.
It's
amazing. Yes, this amazing transformation, and it's happened in 9 months, and then there has to be a period of recovery as well. And sometimes I don't think it's under-recognised. I feel,
absolutely,
I was actually reading, so Peanut and Tommy Teepee actually recently took out a full-page ad in the New York Times, and the headline was, "I don't give a F," is in the dictionary, but Matrescence isn't. Which is kind of insane.
Absolutely, I mean, good for them, and absolutely, it's important to get it out there, and I imagine that's a brilliant way of marketing their products. Good for them for being on the pulse about it, I think. Important.
Yeah, definitely. I wanted to kind of touch on the different conditions that you guys might see, as primary care physicians. So a statistic that kind of popped up for me was 1 in 5 women will experience a perinatal mental health condition, and around 75% go undiagnosed and untreated with that. Why do you think that goes underdiagnosed or undertreated?
Well, it's a bit of a sad statistic. I have to be honest with you. I think it goes underdiagnosed because women do feel a bit of stigma to reach out, like we've already talked about. I do think it's normalised in some respects, and there are lots of different conditions, and I think unfortunately it's not like we can necessarily diagnose you at one visit. Often people are coming to see us. It's a quick consultation normally. You might ask them to come back, but there is obviously a process to it with a mental health diagnosis. So I think that's perhaps one of the reasons that it's underdiagnosed. That the system really that mums themselves are feeling stigmatised and may not reach out, and that the healthcare system sometimes it's very hard to give the level of care you necessarily want to give. And I think there's an awful lot of perhaps lower level mental health that goes on. We often see the more severe levels of mental health, I suppose, as GPs. I don't know. There are a few hurdles to this diagnosis.
Definitely, and it's an interesting one because I think we see a mum for her maternal postnatal check at 6 to 8 weeks, and perhaps that might be the only time that we see the mother in that first year of life, because she may be coming for subsequent visits to the GP for her children, for example. And in that 6-week postnatal check, we are checking for recovery, we are talking about contraception, and it's often, we just don't have enough time to cover maternal mental health in that discussion. Really, at the end, in 10 minutes, we're just opening up the conversation. But I think if there is a concern, we do have to make a point of contact to see, talk to the mum, see the mum again, and then actually screen again for those for any deterioration in mental health as well. It's a tricky one, isn't it? And as I agree with Alice, often mums don't feel that they're able to open up those conversations because of fear of stigmatized and perhaps actually disclosure. They may be fearing involvement of, say, services and so forth. So that can be really, it's a sobering fact, isn't it, when we think about the statistics. 1 in 5, perhaps even 1 in 4 women are affected by maternal mental health conditions. So, it's really interesting to have these conversations and talk about it.
And when you are in that appointment with a woman, you hear the term baby blues quite a lot, which I don't know your guys' feelings on that term, but I think it's such a broad term that can kind of feel like a bit of a brush off of like, oh, it's just baby blues. You'll stop feeling sad. Why are you feeling sad? Do you guys hear mums kind of using that phrase when in clinic with you guys?
Yeah, it's interesting because actually when we talk about postnatal blues, it's a transient period, and it actually affects up to 70 to 80% of women, and it occurs within the first 2 weeks after giving birth. And it usually coincides with a hormonal change at the same time as well. So, it can be sort of an emotional overwhelm. But the important thing to say about that it is transient. But I think sometimes that term can actually be perhaps used interchangeably for postnatal depression, and perhaps why it can often be dismissed as well. And when we talk about postnatal depression, that's something different. It tends to be more persistent and more pervasive, and affects women up to the first year of life as well. So first year of postpartum, sorry. So, and these tend to be sort of more pervasive symptoms. For example, the sort of emotional overwhelm. It can look like emotional numbness. It can look like irritability, sometimes feeling of like hopelessness. And I think one of the big things can be that maternal guilt. I don't know how you sort of see when you see your women in clinic as well.
Yeah, I think absolutely. I think guilt is one of the biggest emotions that people describe, and that I can say that I've experienced myself. I think I often say to my friends, I think that's one of the overwhelming emotions of being a mum should be love. But I think in a close second, there is guilt. And obviously it can become, we often talk with depression, not just postnatally, we also often talk about guilt and this sort of downward cycle that people have of, why am I feeling this way? I feel very guilty that I feel this way, therefore I feel worse. So you often get this kind of circular thing. But of course, as a mum, you are looking after this little being that apparently should bring you love and joy, and does, but also presents you with a huge number of concerns and problems and anxieties and worries. And you're meant to be this, which we've touched upon. I know you're meant to know what to do, and you're meant to be able to cope with this. And so guilt is a big, big, big thing that I would say a lot of our mothers feel. And I think it's if it becomes a cycle and too much of a big emotion, it can really be a big feature of postnatal depression.
It's when it becomes all-consuming and it's impacting you not just on a day-to-day basis. And I guess with that there comes the postpartum anxiety as well. Yes. So often these thoughts, it's feeling on edge, not being able to relax, not being able to sleep when the baby's sleeping, for example. those are, and when these symptoms, they become intrusive, this is, I think postpartum anxiety is actually incredibly common, but very underdiagnosed. Because as a new mum, these symptoms, these feelings are often thought, often dismissed because this is a new mum. Of course you're meant to feel, anxious about the well-being of your baby. But if you're constantly reassuring yourself, constantly checking on the baby's breathing. So these are definitely things that we often see in clinic. Perhaps not as often as we would want them to be, because not always patients will come forward as well.
Absolutely. No, absolutely. And then obviously there's the more extreme end, so things like postnatal psychosis.
Yes.
Which I've probably seen more of being a hospital doctor, but we do occasionally come across it in primary care as well. So that's a condition that affects about 1 to 2 women per 1,000 approximately. And it comes with some quite specific symptoms. So women may present with potentially confusion. They may hallucinate potentially. They may have certain fixed ideas about their baby or about themselves. And that is a real cause for concern. And there's a very clear pathway for those kind of symptoms. And often it's relatives that come to us with those concerns more than the patients themselves. But I would say that it's all, all of these conditions can be somewhere found on a spectrum somewhere. And so often a postnatal, what appears as anxiety or symptoms of depression can potentially evolve into this thing called postnatal psychosis. So, so I guess there's lots of that there are these various different conditions. There's also OCD, isn't there? There's postnatal OCD, which is another mental health condition that's common in the postpartum period. But yes,
and in terms of PTSD as well, we haven't touched on that as well in terms of birth trauma, and perhaps where I often feel this, I think, in terms of our antenatal education as an expectant mother, there's a lot of information out there about normal birth, normal antenatal period, and perhaps we don't have enough conversations about potential complications and what could go wrong, and having that expectation that potentially there is something that could go wrong. And when you're in that situation, the lack of control that can contribute to birth trauma. So, for example, even if perhaps the birth plan wasn't as expected, that for a mother could be birth trauma, and then could lead to PTSD type symptoms as well. And we talk about hypervigilance, which could perpetuate as anxiety in the postnatal period as well. So I think this is all, there's a whole spectrum of conditions that we've talked about, postpartum blues, postnatal depression. I think the most common thing that we often see as GPs is probably postnatal depression. It affects about 10 to 15% of women. Postpartum anxiety, OCD, and puerperal psychosis. And you mentioned about risk factors. I think there are various risk factors, aren't there, I think. So in terms of perhaps a previous history of poor maternal health, or if there was a history of mental health issues in the past, previous history of anxiety, and then if we think about the societal framework as well for that mum, for example, if there was any lack of social support, for example. And then if we think about the obstetric factors, for example, if there was any complications, any birth trauma, for example, preeclampsia or anything like that. And I think I could probably draw upon my own experience, expecting a normal pregnancy, a normal birth, and when perhaps it didn't go to plan, reflecting on that probably did contribute to my own I guess mild postnatal depression as well. So I think those are things that are really what we should be highlighting and talking about more, perhaps in the antenatal period, so that mothers can feel well equipped and know what to expect in the postpartum period.
Absolutely.
Yeah, when I was working in the Royal London on the maternity ward, I worked on like the high risk pregnancy unit, and yeah, what we'd often see were women who, you know, written up their birth plan, wanted to water birth or at home, and, you know, for whatever reason that happened, they kind of found themselves on our ward, potentially going in for a C-section or being induced. And I think that can be, you know, you've created this plan, it's quite a big thing, particularly like new mum, you've not done this before, to all of a sudden be, you know, put into a completely different environment than maybe what you'd built up in your head. And then you're expected to look after a completely new life. You have no experience doing it, and everyone's kind of looking at you. Are you loving the baby? Like, are you keeping it alive? I think, yeah, there's definitely more conversations we should be having when the woman is pregnant. You know, conversations with family members as well, though. Because, you know,
absolutely, yes.
we saw mamas having to rely on their partners, their mums, their parents, their partners' mums, you know.
I always think it's interesting because obviously as doctors we do different rotations, the same as you being a nurse. And I did 6 months of obs and gynae before I had my kids. So that prepares you to an extent, because you've been through it and you've seen, you know, what normal is, and you've seen what not normal is. But it still comes as a bit of a shock, and you know, most mums haven't got that experience, and have had an antenatal experience that perhaps, you know, those 9 months, yes, you've got time to prepare. At the same time, what do you listen to? Who do you listen to?
Yep.
You know, do you do you spend every minute researching and asking other people what their experiences were? Or do you try your hardest to work out your own path? And so I think that's really, I don't know whether you found this, Ruby. Obviously, you did obs and gynae, didn't you, before you had kids as well?
Yeah.
And so you had a good awareness, didn't you? But I don't think anything quite prepares you.
Yeah.
And you're absolutely right. You know, I've seen some lovely birth plans, and you know, for my first, I had a lovely birth plan too. But I think it's the one time in my life where I've been completely out of control, and I don't think anything can quite prepare you for it. It's funny because I don't know how to really counteract that, other than to say, you know, that you have to get some experience, and I think it is really interesting. You know, the MP Theo, Theo Clark,
yes,
she has been leading the birth inquiries. And I just think it's really interesting what she was saying about women having some more knowledge about what can go wrong during births, and about birth trauma. But at the same time, you know, it's so tricky to navigate that without getting really quite frightened about, or maybe not frightened, but just very apprehensive.
Yeah.
Because often as antenatal providers, there's a fear of instilling fear in a mum who's, you know, we're wanting to have this normal pregnancy, a normal birth, but perhaps normalising a conversation that, you know, whilst we hope for this, and we're hoping to try and stick to your birth plan as much as possible, there are things that could go wrong, and perhaps have you thought about this and what, you know, what the pathway might be and what it might look like. So I really do think we need to have those conversations much more. And Theo Clark, as you said, has been she's been working on an antenatal toolkit, for example, for these exact scenarios for expectant mothers. So yes, so there's a lot of work still to be done in this arena, I think.
Yeah.
And it is a complete, like you said, Alice, and I think that really resonated with me as well. Even though, as a clinician, having worked in obstetrics and gynecology, being in that very situation with severe preeclampsia, having a baby born 2 months early, and having a baby ending up in NICU for 4 weeks, not being able to take my baby home, seeing other mothers taking their baby home, having to learn to express, for example, looking at a picture of my baby. All those factors really significantly contributed to, I guess, a little bit of mild post-traumatic stress disorder and postnatal depression. So I think you can have all the knowledge, you can be well equipped, but when you have a lack of control, I think it's important to be aware of those situations as well.
I think that's where I keep coming back to this idea of community again that you touched on earlier. You know, there are so many different cultures across the world, but one thing a lot of them do have in common is when a woman has given birth, there is that kind of community of other women flooding in to kind of, you know, help them bathe, help feed them. Like, it's not focused on the baby, it's actually focused more on the mother. It's really interesting kind of reflecting on that and maybe how we can bring that into practice, you know, in the UK a little bit more. So we can kind of support each other a bit.
Yeah.
I wanted to kind of touch on, you guys have kind of touched on risk factors a little bit there. But what are some of the main risk factors for something like PTSD or postpartum depression and things like that? Does it run in families? Are you more likely to have it if you've had mental health problems before? Yeah. If your birth didn't go to plan, like what's that look like?
I think absolutely. To my knowledge, I don't think there's any connection between familial, you know, between your mum having postnatal depression. Although it's really interesting when you look at mental health conditions more generally, there can often be a small genetic element to it. The common risk factors are previous mental health conditions, anxiety and depression during pregnancy. Then there is the actual birth itself, so birth trauma, this sort of lack of control, but various things that have happened obstetrically. And then there are conditions, you know, I think gestational diabetes is quite a strong risk factor apparently for postnatal depression and anxiety. So I thought that was really interesting. But I think anything that's caused worry during the pregnancy, that's a big one. And then socioeconomic status. So that is one, and lack of social support and life events. So, you know, moving house, divorce, you know, these commonly big life events, they are known to worsen it as well. So there are quite a number of risk factors, I think, and obviously different for everybody. But those are the common ones we often look for.
And to sort of touch on that as well, we know about the risk factors, but we know that mental health conditions in the postpartum, perinatal period, antenatal period can affect anyone. So that's important, you know, just because there may, you know, we know about risk factors, but maternal health conditions can affect any mum. And I think that's really important for us to sort of highlight as well. But also things like domestic violence, unfortunately, increases in pregnancy as well. And I think we can't have these type of conversations without actually mentioning things like in terms of maternal deaths as well, really sadly, really sobering that the period from 6 weeks to 1 year, maternal deaths caused by maternal health conditions is the leading cause. So suicide, for example, is the leading cause of maternal death. And that's really sobering. And I think when I read, you know, knowing those statistics, it really just highlights how important these conversations are, and inequalities as well. So Black women are 4 times more likely to die than white women. And again, these are really sobering facts in terms of inequalities. And we need to do a lot more work in this arena as well. So, and the other thing that we are also seeing is that there's a rising rate of suicides in young mothers as well, especially in those under the age of 25. And I don't think that's actually just specific to maternal deaths. I think that is something that we are seeing as a society in general. So there's something concerning. There's a concerning pattern that's going on there. And perhaps it is society. Perhaps there is something that we need to research. So we need to look at that in a bit more detail as well.
Definitely. And I think if you are a friend, a partner, a parent, a sibling of someone who is pregnant, trying to get pregnant, just given birth, even, you know, I think most people think you've given birth, like the baby's fine, you should be fine. But actually that care and, you know, questioning the mother, are they okay? Do you need any help? You know, should it extend probably past a year as well, you know?
Oh, absolutely, yeah. Yeah, definitely.
And what can the support system do to help? Do you guys have any like tips? You know, is it going around and cooking for them? What questions can we be asking them? What should we be looking out for when we're going to see our friends who have just had babies?
I think there's lots of things that can be done. I remember my friend had a sheet on the wall, and as you walked into her house, there was a series of tasks, and you ticked a box, and then you went and did that task, and then you went to see how she was and how her baby was. So I think practical help is really can be really, really helpful. You know, not saying too much at times, not offering too much advice. Asking open-ended questions, just being a constant source rather than, making an intervention. Certainly when I had my second child, I was, at the time, I had two children quite close together. They were both in nappies. My husband was travelling. We were in temporary accommodation. You know, it was quite a rocky start when I had my second child. And I had one particular family member who was just a constant a person who would check in with me every day. And we really didn't need to speak about anything. It was just having somebody there or somebody there at the end of the phone, or not even there every day, just somebody who was looking out for you. And that was a huge source of comfort for me. So it's obviously different for every person. And some, you know, same as day to day, you know, ups and downs. Different people need different things from different people. But certainly there are some things that people can do on a very low level, I think I would say.
Yeah, absolutely. And I think we keep coming back to this tribe, don't we, that we need. And then perhaps maybe talking about it, you know, in pregnancy, who is your support network going to be? Who would you reach out to? Speaking to friends, family members, and then just highlighting to them actually what can they do to check in on you. And it may be just providing some nourishing meals actually in those first couple of weeks, you know, going out for a walk, bringing them a coffee from their favourite coffee shop. So these are the kind of very basic things, and it's the basic needs often that we need to refer back to. That really helps, I think, provide that initial support in those first few weeks, I think.
And if someone, the mother themselves or their tribe around them, if someone is concerned, you know, maybe they're a bit more withdrawn or they're just feeling really overwhelmed, what would be their first point of call?
So in terms of talking with any sort of healthcare professional, so, you know, there may be the midwife in the initial few weeks, the health visitor, and then the GP often tends to be the first point of contact. So whether it's, a family member can definitely reach out if they've got concerns about their loved one. Maybe speaking to the mum themselves and saying, look, I'm concerned. Can I come with you? Can I offer you a hand? I'll walk with you. I'll come to the appointment and we can talk together and hopefully relieve some of that pressure that you're experiencing. So often the GP is the first point of contact. There are some online charities as well. So there, in terms of if there are, we talk about low-level symptoms, but there are some charities as well online. So, for example, Mind, it has a really good dedicated perinatal mental health support page that talks about symptoms. Are these any of these symptoms are you experiencing? Maybe talk to your GP, for example. Pandas is another good one as well. That's online as well. So they're really good charities and online help, aren't
and
they?
they often have helplines, ways that you can contact them. If we have concerns ourselves as GPs, if we feel that we need to refer onwards. So we don't refer everybody onwards. Sometimes there's a conversation to be had and often it is about then a follow-up appointment. But sometimes we need to refer to the Perinatal Mental Health team. And actually in my area, you can actually do a self-referral. It's not everywhere in the UK, but certainly where I work. So family members, partners can refer directly to the Perinatal Mental Health team, which I think is great. But as a GP, that is often my port of call. And they're generally very excellent. And even obviously it depends on the specific symptoms and the actual severity, and often there's a process, quite a long process involved. But if they don't feel that they necessarily need to intervene, they have a lot of these services. So there are often local services that are, Pandas and other. Mind is obviously UK wide, but there are often a lot of local services. So breastfeeding cafes and baby groups and children's centres and things that are available to local mums. And I'm always, I don't think these things are necessarily always really obvious, but they can be signposted to these things.
And we are almost out of time, unfortunately. I feel like we could talk forever on this.
Yeah,
and
absolutely.
We should be. We should be talking more about this.
Absolutely.
But I did just have like a few final questions for both of you. So what's one thing you wish every pregnant woman was told at her 12-week appointment?
Oh, her 12-week appointment, as in just got pregnant?
Just got pregnant.
That's a really difficult one. I'm going to defer to you, Ruby.
I'd probably go back to, we're hoping for, anticipating the normal antenatal sort of period and a normal, what we call a normal birth, but things can go wrong. And if it does go wrong, there is help, there is support. I think that's really important to have a conversation with a mum at her antenatal period, that things might not always go as planned, and just to be aware and perhaps have your own, birth plan in case it does go wrong, for example. So maybe have 2 birth plans. And I think that would be a really good conversation to have, I think, very early on in pregnancy. So, yes, I think that's what...
That's a great piece of advice.
Maybe that's what I would have wanted at the very beginning as well. And perhaps it would have helped me a lot. Yeah.
And if Matrescence was in the dictionary in every midwife leaflet tomorrow, what do you think could change for women?
I think it would really just help us have a conversation, maybe antenatally, maybe postnatally, but a conversation about this lack of control that you're feeling and these symptoms that of perhaps tearfulness, of perhaps disconnection, of perhaps a loss of identity of yourself, that is something that is very, very, very normal, and is, we understand that there are biological changes that are going on inside your brain. Obviously, there are social changes, psychological changes as well. But just having a word to be able to describe that feeling, certainly for me, I wish I'd had this word. I felt a massive loss of identity. When I had not so much my first child, but my second child, I then really felt, goodness, why has nobody ever told me about this? What I honestly felt like I'd been lulled into this into this world of motherhood, and I hadn't gone in with my eyes open. And so I think it's a wonderful word to use for women who are perhaps feeling that way. They don't yet meet quite that level for postnatal depression, but it's a very common thing to feel. I don't know how many people feel it, but it certainly is a thing, and it needs a name.
Yeah, absolutely. I think I would agree with Alice that it's a transition, it's an evolution. And, you touched on the neurobiological rewiring of the mother's brain, talk about emotional empathy and the vigilance that you experience as a new mum. And for example, if I talk about things, perhaps before pregnancy, before having children, I wouldn't have thought twice about doing things like skydiving. Yep. I don't think I would be doing that anymore because, and it's that kind of sense of protection that you have. You're transitioning into motherhood. It helps validate it. Yeah. I think it helps validate it for women and recognise what we're experiencing.
And my final question, so if there is a mum out there that's listening to this conversation or watching it, and she feels like she's been silently struggling for months, for maybe actually over a year, what's the thing you would like to leave her with? Like what thought?
I would say, please, in whatever way or capacity, reach out for some help. Obviously, that's, different for different people. As a GP, I would say, please go and see your GP. Please seek out that GP who is perhaps also a mother herself, who is perhaps interested in women's health in your practice, and go and speak to them. But obviously, some people, don't, often we talk about people coming in to please the GP. They want to say the right thing and they want to. So some people don't feel able to speak to their GP, but there are other sources of support out there. So I know it's unbelievably hard, and it's often very hard to make that first step, but I would really encourage them in whatever way, shape or form to think about who they're going to approach and to approach that person for some help.
Yeah, I'd definitely say the same. I'd say you're not alone. If you can today, just reach out to that one person. You don't have to walk this journey alone. Let someone hold your hand and walk this journey, whether it's to the GP, whether it's to the midwife, whether it's picking up the phone and speaking to your health visitor, whether it's speaking to Samaritans. There is help out there, and somebody is ready and waiting and able to help you. And we will get through this.
Really, really good words to leave someone with. Thank you both for taking the time today. I feel like this has, been such an eye-opening conversation. And I feel like that sense of community, speaking to women, making sure that you are leaning on each other was something that I personally took out of this conversation. So thank you both.
Thank you.
Thanks
Thank you for inviting
us.
us. Yeah, great conversation, and hopefully we'll continue it forward as well.
Yeah. If you enjoyed today's episode, please follow and share Patient in the Room wherever you get your podcasts. We'll be back soon with more conversations.